This is Dr. Yana Finkelstein coming to you from Houston, Texas, and I wanted to talk to you today about osteoarthritis, particularly osteoarthritis of the knee. Osteoarthritis is the most common cause of pain and disability due to knee dysfunction. It results from wear and tear on the articular cartilage. So the knee joint takes a lot of pressure, and the heavier you are, the more injuries you've had, the older you are, the more wear and tear that joint has sustained. Normally it has a smooth gliding surface of cartilage between the two main bones, and that cartilage can start wearing down. There are three compartments: the medial compartment, the lateral compartment, and the compartment under the patella or knee bone. And either of those compartments or all of them can be involved in arthritis. You may have symptoms of the knee locking, swelling, aching, and it can be an insidious onset. It can start very gradually. One of the first things people notice is difficulty with stairs, climbing or going downstairs. It becomes harder to do your regular activity. And there can be a vicious cycle. Once the knee starts hurting, people tend to not do as much, they may gain weight, they start having muscle atrophy, and the disease can progress. So what do? First thing is get the correct diagnosis. You got to see your doctor, get an exam. There are certain things on physical exam that are very characteristic with knee arthritis, but can also occur in other conditions. So osteoarthritis of the knee can present with knee swelling, knee locking. You can have enlargement of the knee joint due to osteophytes or bony spurs that grow around the joint. And there may be a small effusion, which is fluid on the knee. All of these findings can be found together or sometimes in isolation. Your doctor can see some of these on physical exam. The other thing you can do is obtain an x-ray of the knee. On the x-ray, what can be seen is narrowing of the joint of the knee. And again, this can be partially in the medial portion of the joint or in the lateral. Sometimes it's only under the kneecap. And depending on where the worst arthritis is, the treatments may be different. What can you do at home with this problem? Number one is you need to stay active. The quicker you become sedentary, the more the disease tends to progress and the more disability occurs. So it's really important to continue activity. Sometimes activity needs to be modified. You may need to use a brace during activity, but you want to keep active. Some people go to less weight-bearing activities such as swimming, biking, rather than maybe continuing to run or do sports activity. Other things that you can do are medications such as anti-inflammatories or Tylenol, or acetaminophen. There are some dangers with using a lot of those medications. The anti-inflammatories such as aspirin, ibuprofen, naproxen are all helpful, but they can cause problems such as stomach ulcers, kidney disease in the long run. So you have to be careful and consult your doctor if you're using these on a regular basis. So I want to talk to you guys a little bit more about treatment for osteoarthritis of the knee. Besides medications, there are certain things that you can do at home. Everyone remembers the RICE protocol: rest, ice, compression, and elevation. Well, it's a little bit modified in the case of osteoarthritis. Rest is still important, but you don't want to rest too much. You really do need to stay active. Ice may be helpful after activity, but in general, cold tends to exacerbate osteoarthritis. So applying heat prior to exercise is very helpful. Compression. Compression is quite important with osteoarthritis as the joint tends to swell, and wearing a neoprene support of the knee may be quite helpful. Elevation, I'm going to substitute exercise for elevation. Definitely if your knee is swollen and painful, elevation may help, but I like the E for exercise in the case of osteoarthritis. So remember the RICE protocol for treatment at home. Another thing that may be very helpful to stay active with osteoarthritis of the knee is unloading pressure on the knee. This can be done with assistive devices such as canes. It can also be done with special braces that take pressure off of a certain knee compartment. So look for things you can do at home, with your own home remedies to help with your arthritis of the knee. If it progresses and gets worse, definitely see your doctor. Injections may be helpful for pain relief. You can get prescription strength anti-inflammatories. And the last stage definitely is surgery. Surgery for osteoarthritis of the knee can be helpful, although arthroscopy is quite controversial and it's unclear whether that helps the majority of patients. Total knee replacement is a big step to take, and you have to remember that those replacements can fail, so you want to be a little bit older when you consider that. I definitely discourage my patients who are in their 40s or 50s from pursuing that unless they're really completely disabled from their knee arthritis. Other things to consider with arthritis of the knee is previous trauma and making sure that you do have that addressed. One of the things that can really predispose you to arthritis of the knee is tears of the menisci, which are the donut-shaped cartilage that's right in the middle of the knee joint. Ligament instability such as anterior cruciate ligament tears, and previous trauma such as fractures that involve the joint of the knee. Those definitely need to be addressed in a timely fashion to prevent further disability from knee arthritis down the road. This is Dr. Yana, MD, and this concludes our segment on osteoarthritis of the knee.